Now, a lot of people think of dementia in terms of it being a natural part of the aging process, and that's because...
Have you ever seen or heard of any young person beyond the age of the required age group that have dementia?
And they can be very, very subtle. And I'm sure that your listeners will have had their lives touched by someone affected by dementia, and they'll be able to give different examples.
The estimated value of dementia is expected to rise. And according to a research that I've picked up on in the UK, that 70,800 people living with onset dementia. That's a high value. Why is it so high in your knowledge?
Short sentences. Don't question or point out somebody's reality as being incorrect. You know, they'll say, no, just as an example of, people that I've interacted with, family members, you can say, hi, who have you seen today? No, I haven't seen anybody, nobody comes to visit me, and we know that that is incorrect. Wow. And to actually start saying, no, that's not correct, can be confusing. So we have to handle it very gently. The other thing is, don't give too much information. So instead of saying, what would you like to do today? And that means they have to think about it and process that. One of the ways to handle that would be...
The birth of this podcast is deeply personal. I've poured out countless hours into finding the right guests, shaping each conversation, and crafting every episode with intention. My drive comes from a live experience, from pain, resilience, and a desire to make a difference. By subscribing, you're not just supporting a podcast, you're helping grow a community, built on healing, honesty, and real impact. Thank you for being here. Now, let's get into the episode. Thank you.
Welcome back to the Ivy Cancer Podcast. Dr. Tracy, how you doing? How has it been? Your week has been?
Not bad at all, thank you. Thank you for having me back. It's good to be here.
I ain't gonna lie, I'm enjoying this series, and I'm sure our listeners are enjoying this series. As per usual, we normally say a word of prayer, so I'm going to pray given the fact that you prayed the last time. So can we go ahead? Our most righteous and eternal Father, we give you thanks for this gathering again, as we are about to partake in another series of the brain, where we learn the different different sickness that can cause our brain to malfunction. Give Dr. Tracy the words to utter to us and give us the knowledge to understand and take in. Forgive us in Jesus' name. Amen. Dr. Tracy will be talking about dementia, and I'm going to get right into it. There are more than 55 million people living with dementia around the globe. It is estimated that this number will rise to 139 million by 2050. 1 in 3 people from the UK today will develop dementia in their lifetime. Researchers commissioned by Alzheimer's Society shows that around 1 million people in the UK have a form of dementia. By 2040, 1.4 million people will be living with the condition in the UK. And million more carers, patients, families, and friends will be affected. There are 70,800 people living with the young onset dementia, where symptoms develop before the age of 65. It is estimated that 70% of people in care home have dementia or severe memory problem. More than 25,000 people from Black, Asian, and minority ethnic group in the UK are affected by dementia. Dr. Tracy, what is dementia?
So dementia is actually an umbrella term for a number of cognitive functions. So we can think about language, thinking processes, memory, may also be behavioural responses. And this word encapsulates all of these processes that affect persons living with dementia on a day-to-day basis. Now, a lot of people think of dementia in terms of it being a natural part of the aging process. And that's because our risk of developing dementia actually increases the older we get. However, dementia is not a normal aging process. So what we see as we age, we do see things slow down. It's harder to remember things. This is quite natural. This is wear and tear. Dementia in and of itself, we're talking about, for example, Alzheimer's disease, Lewy body dementia, Parkinson's with dementia, frontal temporal dementia. These are all very different, but something that is characteristic across them is that we see a build-up of proteins that cause dysfunction in the cell. It gets overwhelmed in our brain cells, in our neurons, and we'll see progressive decline in cognitive function and also progressive cell loss in different regions across the brain.
Have you ever seen or heard of any young person beyond the age of the required age group that have dementia?
I haven't seen anybody myself personally. So the work that I did in the lab was actually on postmortem brain tissue. So I didn't actually interact with patients. We were looking at a molecular level. However, we do know that there are early onset dementias, and this, for example, I think we'll be talking about it, frontal temporal dementia often presents earlier than what we would expect of the dementias, which is around 65.
What are the earliest signs of dementia that people often overlook?
And they can be very, very subtle. And I'm sure that your listeners will have had their lives touched by someone affected by dementia, and they'll be able to give different examples, because dementia in and of itself is not just about memory, which is what we tend to think about dementia as, losing memory or becoming more forgetful. And that absolutely is the case. But it might be repetitive questions, for example, or getting lost in really familiar places. It could be forgetting somebody's name, forgetting where we've left our keys, for example, even though keys have been left in the same place every day for many years. So it can be really, really subtle. And in some of the dementias, it can actually be motor symptoms. You can start to see, for example, symptoms associated with Parkinson's disease, where you may see a resting tremor. It may be frontal temporal dementia. We start to see personality changes, and maybe social skills are more compromised. So it's really quite variable.
The estimated value of dementia is expected to rise. And according to a research that I've picked up on in the UK, that 70,800 people living with onset dementia. That's a high value. Why is it so high in your knowledge? What you think causing these things?
Lots and lots of different things. So one of the risk factors for developing dementia, for example, will be chronic stress. And chronic stress, we know, is problematic at the moment. We talked about this in the first podcast. Not only that, another risk factor will be things like cardiovascular disease. And we are seeing that there are many people with metabolic disorders, obesity, all of these things. These are risk factors for the dementia. So it could be, in actual fact, these modifiable lifestyle factors that are impacting the number of cases that are being seen. Because you're right, it is a lot, and unfortunately it's continuing to rise. Another risk factor is things like poor sleep. Now, how many people do we know are on their phones late at night? Doom scrolling, for example. We also know physical exercise is able to reduce the risk. Are we seeing a decline in physical activity in our younger generation. And of course, when we look at these modifiable risk factors, they're starting to add up
Yeah.
and potentially tip someone in favor of developing this neurodegenerative process that we see in the dementias.
What are the causes of dementia in the brain?
Okay, so we'll pick a couple of the diseases characterized by dementia, and so this is a little bit, goes a little bit heavy on the science. So we know that there can be a genetic component, but there are many other factors. And what we're seeing I'm going to take Alzheimer's disease, for example. We see two proteins, amyloid beta and the tau protein. These are normal proteins. They have a normal role in the brain, and they start to alter structurally and also their role, so their functionality. And what happens with this is they start clumping together. Now, what we see, for example, in Alzheimer's, we see what we call tau tangles inside the brain cells. Now, tau itself is part of is involved in, let's say, shuttling different components around our cell, including nutrients, and these start to tangle. So this compromises the integrity of the cell. Amyloid beta forms what we call plaques in between neurons. So that's an example for Alzheimer's disease. Now, we know there is a genetic component. For example, there is a gene called ApoE4, which increases the risk of developing Alzheimer's disease, but having the gene itself doesn't necessarily mean you will. Okay, so it doesn't automatically mean you're going to develop Alzheimer's disease. So let's take, for example, Lewy body dementia. So we know with Lewy body dementia, there's a protein called alpha-synuclein. It has a normal role primarily at the synapse, which is the part of the neuron that starts to get ready to communicate with another cell. So alpha-synuclein is involved in neurotransmitter release, amongst other things. So has a completely normal role. And for some reason, it starts to behave in an aberrant way, whereby it starts sticking together. And this is what we're seeing. We call them aggregates. It might be small oligomers, fibrils, and start to create larger aggregates that act like a bit of a roadblock and compromises how the cell's able to work.
Because we are putting together some solution to this series that we come together and agree on. I'm going to ask you some questions pertaining to how could we keep these proteins healthy, but I'm going to leave that for the podcast coming up. But what does it look like when someone has dementia? How does it affect them?
Okay, and again, so it really does depend on the type of dementia, whether it's Alzheimer's disease, which is very much associated with memory loss. And we can see things like, and yet when we look at, for example, frontal temporal dementia, it can be very much about personality, language, so changes in speech, and social behavior. So it's very, very different. But if we just look, if we take a very general look, it will also depend on the stage. Remember, this is progressive. It gets worse with time. And so to start with, it might look like very subtle changes.
All your point, doctor. So you said it get worse with time. That's the only direction can it take? Can it not?
Yes. It's progressive. It's a progressive decline, which is why your upcoming podcast, where we will talk about reducing the risk, is why it's so important. Once this cascade of events has actually started to overwhelm the cells so that they're starting to die, we cannot cure. So treatments are looking at reducing the progression but we cannot cure the dementias at the moment. So, for example, you'll have somebody to start with that may forget a face, somebody's face and their name. Eventually, they will potentially forget who you are if you're their child. And this is a devastating impact. You know, it also can affect the regions of the brain involved in breathing, for example, and swallowing. So to start with, when someone gets a dementia diagnosis, they may still be able to drive. So there will be some cognitive changes that have been noticed, but they may still be able to drive and may be fairly independent. However, as it progresses, that independence means that the individual is not able to take care of themselves, and they do need supported care.
I'm gonna ask you, because you mentioned about care, and it's really, really unfortunate. It's so unfortunate that people have to go through this. And first, and family members, the wife, the husband, the kids, the mother, they've been affected so much.
Mm.
And I was watching recently a video from Bruce Willis.
Mm-hmm.
His daughter put out a statement on social media as to, obvious the reason, the stuff that her father had requested. But Bruce Willis has dementia.
Mm-hmm.
And some of the stories, some of the videos that I've seen, it's really, really painful. Do you know that Bruce Willis has dementia?
Yes, he has frontal temporal dementia. I think to start with, he was diagnosed with some challenges around language. I think it was aphasia. So we see this in frontal temporal dementia. The temporal lobe is responsible for, is involved in language. So I think he was firstly diagnosed with some language concerns, which then progressed to frontal temporal dementia. And I think when you're talking about his daughter and the challenge, the impact that this has on wider, on other family members, it's absolutely devastating. Depending on the presentation, for example, frontal temporal dementia can change personality. So your loved one suddenly behaves in ways that you don't recognize. Lewy body dementia can be associated with hallucinations, and seeing your loved one hallucinating. Not only are they scared, but it's going to have a huge impact on the persons around them as well. The level of stress on carers or family members taking care of their loved ones, they're grieving, and their loved ones still with them.
You mentioned that he was diagnosed with some language thingy before. With that, could something be done pertaining to that? Could it be treated to not get to this stage at this present moment that it is not now?
So it probably would have been like speech therapy, this type of thing. However, if it actually was associated with the dementia, it was just an early indication that the dementia, frontal temporal dementia, onset had started. So it's very, very common for people to be misdiagnosed. And the reason for that is you cannot go in and scan a brain and say that person definitely has dementia. We can see shrinkage in certain regions, so we call that atrophy, regional changes, but that in and of itself is not a diagnosis. So it comes also from an assessment, usually psychiatrists, that will ask lots of questions, and based on that, they will make an informed decision around which dementia they think it is. Actually can't essentially be 100% sure until post-mortem.
It's so sad, man. But
We see mixed dementia as well. So we can actually see the pathology associated with Alzheimer's in Lewy body dementia and vice versa. You know, I talked about sort of amyloid and tau in Alzheimer's and alpha-synuclein in Lewy body dementia. When you actually look at the brains post-mortem and do various techniques to have a look at which proteins they were, you can often see both. So it's incredibly difficult for psychiatry to actually make that, the decision as to which dementia it is based on symptom presentation.
I've a question, but I would leave it to the next podcast. But I was going to ask you, is dementia preventable? But I want to leave that until the next interview. But how can families better communicate with someone living with dementia? Because as we spoke earlier, it's very, very difficult. And I can remember when my aunt, she unfortunately passed, and she had Alzheimer's. And one of the things that I remember is that whenever she ate, she don't even remember that she had something to eat. And it was very difficult for my cousins to be dealing with those stuff. And these were some signs that they were that they were seeing in her while she was on medication. And one of the things that I assumed, I didn't really get no clarification on it because I never asked, because I know it's hard. But she had a pacemaker and she was getting medication, and it wasn't long after she started getting those medications she developed Alzheimer's. So my assumption is that all of those medication probably led to her diagnosis in dementia, in Alzheimer's. But families, how can families communicate with their loved one that is with dementia?
Okay, so I just want to quickly go back to the medication. I'm not aware that we have the evidence. Some medications may increase the risk, but it's unlikely the medication would have caused the Alzheimer's. If there was
Okay.
also some concerns around cardiovascular health, that does impact our risk for dementia.
Yeah, I've
So there's
seen that in my
multiple.
research, the
Yeah,
cardiovascular. Yeah.
yeah, absolutely. And what's good for the heart is good for the brain. If it's not good for the heart, then it's going to increase our risk of developing dementia, most likely. But in terms of how to communicate with family members, as our loved ones, a couple of things really. So some persons become quite aggressive. So it's really important that we maintain a level of calm. They're also can become very, very anxious. I mean, it must be incredibly scary when you start to notice or become disorientated, your reality is shifted. So it's important we communicate calm. But the other thing is, short sentences. Don't question or point out somebody's reality as being incorrect. They'll say, no, just as an example of people that I've interacted with, family members, you can say, hi, who have you seen today? No, I haven't seen anybody. Nobody comes to visit me. And we know that that is incorrect. And to
Right.
actually start saying, no, that's not correct, can be confusing. So we have to handle it very gently. The other thing is, don't give too much information. So instead of saying, what would you like to do today? And that means they have to think about it and process that. One of the ways to handle that would be, would you like to go for a walk today? It's much easier. I think, from my perspective, in terms of the face-to-face care, that's not something I'm well qualified on. I was in the lab looking at doing the research around the progression of dementia. So probably be other people that would be better placed to answer that question. But if you think about how it presents and the types of things, the forgetfulness, telling somebody they're being forgetful is not helping.
You mentioned about you were into the lab. And I remember doing my research for this podcast, and something came up where the researchers are linking microplastic to dementia. Have you worked on any physical brain disease brain, and have you ever come across those research about linking the microplastic with the brain and
So not
dementia?
microplastic. So the work that we did, we were looking at the synuclein family of proteins. This is when I was looking at Lewy body dementia, because I also looked at Parkinson's with dementia, and also Huntington's, which is different because that is entirely genetic. And we were looking at how these proteins changed in different regions of the brain. But in terms of these microplastics, I am seeing research coming through for lots of different things, also looking at pollutions, for example. What they're not saying is that the microplastics are causing dementia, but what they are saying is in dementia versus non-dementia brains, there are higher levels of microplastics. I think that was a suggestion. Now, one would argue whether or not, because we have the cells have equipment to do housekeeping duties, clear up toxic products and get rid of things. It's really good at doing that. If you have a brain that's overwhelmed with these protein aggregates associated with the dementias, it's very possible that this equipment's not free to clear up the microplastics that it might otherwise. Can you see what I mean? The cells are already overwhelmed. So that's one of my thoughts on that. However, I think it's a really fascinating area of research, and we should absolutely be exploring it, and also exploring how these microplastics are ending up in the brain. So, we have a blood-brain barrier, and that we try to prevent certain things crossing into the brain. So it's got really good protective mechanisms. However, when that system is overwhelmed, then maybe, the role of the blood-brain barrier is not as robust. So that's one of the things that we can be talking about when we're talking about how to support and take care of our brain to minimize the risk of any of these things happening. The other thing that I would say, and I think it's a really important point when we're talking about microplastics, for example, inflammation is key. Brain inflammation is key in the dementias. Now, we have immune cells that keep our cells safe, our brain cells safe. And the right amount of inflammation absolutely does that job. But if we have got these protein aggregates in the brain, they do trigger an immune response. An immune response fast tracks the process of dementia, the acceleration of neurodegeneration. So thinking about microplastics coming into the brain, that will trigger an immune response. So that, although it may not be the cause, the immune upregulation of the immune system might not be the cause of the dementia, it will certainly antagonize an environment in the brain that might be tipping in favor of dementia. Does that make sense? It's quite very complicated, but it's fascinating. It's why it's so difficult to find a cure.
It is. One researchers suggest that it might be from the pollution in the sea, whereas the fish, because they've been finding fish with loads of plastic inside, and obviously it's because of the pollution. So one researcher suggests that it could leach through the food that we're eating.
Yeah.
Right.
Entirely possible. I mean, this is the thing, isn't it? When we're thinking about, technically, microplastics shouldn't be able to get into the brain.
Right. Right.
And that's what we need to be, it's even nanoparticles, tiny particles. There's lots of research looking at these, because we're much more advanced in our skincare products, medications, and things like that. And of course, these will enter into our water systems.
It's so hard to to try and be healthy in this time and age, isn't it?
It is, but there's many things that we can that we will be talking about that we can do to give ourselves a good chance.
And I can't wait to have that podcast. I'm looking forward for it. Are memory boosting supplements or brain food actually effective?
There's no real science around supplementation. Now, one thing I will say is for some people, absolutely, they may need supplementation. For example, B12 is incredibly important. In fact, all the B vitamins are really important for our health, including our nervous system. And of course, if you're vegan, then it means you will not be getting your B12 comes from animal sources, but not all of our B vitamins do. So it's really important that if you have any concerns, that you speak to your doctor. If you're, especially if you're concerned, if you are vegan, because I know people get B12 shots, for example. So that is incredibly important. We need to be making sure that we're supporting our needs through our diet. But I am not an advocate for supplementation unnecessarily. Now, B vitamins are important for the brain. Get them from our diet. I said about animal sources, but also lentils, nuts and seeds, for example, and also fortified. Some of our foods are fortified with the B vitamins. And omega-3 essential fatty acid. Essential fatty acid means that we need to be getting it from our diet. We need to be eating, and we get that in nuts and seeds, but also in oily fish. So oily fish, really important. If we think we're not meeting our omega-3 fatty acid needs through our diet, again, have a conversation with your GP and just double check that it's okay for you to supplement. The other thing that we know is really important, vitamin D. We get vitamin D from sunlight.
Right.
And many people actually, vitamin D is important for the brain, also mood. And there are guidelines in the UK for supplementation during the darker months with vitamin D. So that is one that maybe I could advocate for.
You mentioned about supplement. Obviously you talk about fatty acid and stuff like that. But growing up, I've always heard that omega-3 supplement is always good for brain. Isn't that a factual statement?
Yeah, so omega-3 fatty acids are important for the brain. First and foremost, we want to be getting them from our diet, and that's the oily fish, nuts and seeds.
Okay.
Should be able to, and that's where I was saying, any concerns, speak to your doctor, always check with your GP before you supplement, and that's just to make sure that you've got no contraindications around any current medications you're taking. But no, omega-3 is really important. So oily fish, nuts, seeds, walnuts. Walnuts look like a brain.
I love walnuts.
Same, linseed or flaxseed, wherever you are in the world, great. So get those nuts and seeds, snack on nuts and seeds.
But you mentioned something, because I'm not a vegan, but I try to eat more whole foods, and my meat intake is limited these days. But you just said something I'm really concerned about. But you also obviously recommend a shot about vitamin B12 shots. But you said we can't get any vitamin B12 from plant-based, only from meat.
So B12, you will often find, I want to fact check.
Right.
My understanding, B12, if you, unless you are eating fortified foods, you need to get your B12 levels checked. And the doctor will do that in a normal screen, or they should do anyway.
Okay. I love my independence. I like to be, I don't depend on people. My mom was the same. And that was one of her challenge when she was in the hospital, because she couldn't get to do stuff on her own. So for someone that is independent, what a dementia diagnosis is like for them?
Yeah, I mean, as the disease progresses, remember things like being able to access bank account, being able to remember your PIN code for your bank card. Being having things like being able to drive. And that's why early in dementia, my understanding is power of attorney needs to be assigned to a loved one, so that these tasks can be taken over, because it is progressive.
That's a
It is
good
only going to
point.
get worse.
That's a good point, Doc. I kind of be concerned, to be honest with you, because um, I'm very, very dull when it comes to my memory. Like this morning, I went into the fridge to take out something, and for the love of God, I didn't remember what I went in the fridge for. And I come out the fridge, and I knew that I went in the fridge for a particular reason.
Yeah, yeah,
And I don't know, the mind play tricks on you
yeah,
sometimes because, you know, you mentioned that sometimes, and even in my reading earlier, it mentioned that these signs come up very early, and one of them is memory.
yeah.
So
We
I'm a bit, you know.
I know. We can speak. It is concerning for us when these things come up, but we also need to remember, even going back to the first podcast that we did, when we are chronically stressed or overwhelmed, or we're working on autopilot, we will get forgetful. Working memory. It's if we're tired, then we will get forgetful. You
You
know.
know, we I've done a podcast about burnout recently, and um we tend to not understand that people who care is very important. But what are some of the support that carers need, and why is burnout of carers so common?
Yeah, I mean, if you think about, if you're caring for a loved one, and 24/7, you're not getting time out. We also need to remember that someone with dementia, they may have dysregulated sleep, but also they wonder. So you're always going to be hyper vigilant. Where are they? Have they got out of bed? Have they left the house?
I
You know,
see.
you cannot, if you're 24/7 carer, then you cannot, this is a state of chronic stress. And unfortunately, the health of the carer will affect also the person they're caring for. I mean, the caring profession itself is incredibly hard. But imagine if you're caring for your loved one at home, and you're going to have dysregulated sleep. You can't just say, I'm going to go and take a nap. You might not get the opportunity to eat as regularly as you want, or as healthily as you want. It might be kind of grab and go.
Right.
And the worry, you think about watching your loved one decline is devastating on mental health, and this sense of grieving someone who's starting to grieve someone who's still with us.
It I know understand, because some time ago, this lady had her dad, and her
Mm.
dad had Alzheimer, and he left the house. I don't know how he left the house without she knowing, but she couldn't find him for days.
Yeah, yeah,
And she was, on social media pleading for his return. And eventually the citizens, the community found him. But I can imagine the impact it had on her at that point in time. It must have burned her out.
absolutely devastating. It's because the other thing is, if somebody, just the knowledge that is that, how you feel about the fact that you don't know where they are, that's scary. But also thinking about how they feel,
Mm.
how scary it must be for them. And you just hope and pray that other people will notice. So it's good to check in with people. Are you okay? Do
Mhm.
you need any help? If someone looks confused or looks lost, it doesn't necessarily mean that they have dementia. but check on them. And, you know, if you have elderly neighbours that may be slowing in terms of their cognitive capacity, whether they have dementia or not, you know, ask them if they need anything. They
Right.
may need help with communicating around banking, or, you know, I know we need to be careful because, you know, they're also very vulnerable, but are they being checked on? Some people don't have close family members, you know, so that if you've got somebody who's struggling, they don't know that they need to go to the doctor, maybe for a diagnosis.
Yeah.
It's, you know, we really do need to remember that, you know, I'm talking about elderly because it's more prominent in the elderly, but it's not just the elderly, of course. But we should be taking care of our elders regardless, checking in, just, are you okay? Do you need anything?
Yeah, because there was the research when I was doing, people that tend to be diagnosed with dementia is in their early 70s, late 60s. But I'm sure I remember some time ago, I've seen a video where this 50-year-old or 40-something-year-old woman had dementia or the signs of dementia. I don't remember quite, so I won't quote it on that. So some people would name it as the elder
Yeah, yeah,
disease.
yeah. And
But
it's,
nothing is really elder disease anymore because when you think about it, they used to say breast cancer was of the elderly,
yeah,
but
yeah,
breast cancer is also in younger women. The
yeah,
last person I've seen with breast cancer, she was 25 or 28, something like that.
yeah.
So
I think.
I don't think that is the case anymore.
No, I think because like I said at the beginning, the biggest risk factor for dementia is age. You know,
Right.
the older you get, the greater the risk. And I think the reason for that is everything does start to slow down. And so, you know, this clearance mechanism I was talking about, getting rid of like proteins that not behaving the way they should be.
Mm-hmm.
If we can get rid of them, we don't see symptoms. However, this ability to do this declines. Our cells get tired, they start to run out of energy. So it's much easier for the cell to become overwhelmed when we're older because its capacity is less. It's not as vigorous at getting rid of these proteins. But one thing to remember is nobody is immune from dementia, because we cannot say specifically what drives it. It's not a single factor, a single driving factor in essence, you know, but we absolutely, and I'm talking about Alzheimer's and Lewy body dementia, Parkinson's dementia. I'm not talking about Huntington's. That's completely separate. We see dementia in Huntington's, but this is solely a genetic condition. So I just want to keep that separate, really.
I'm not, this is why I'm concerned because I knew there was a question that I wanted to ask you regarding to Bruce Willis and I totally forget. But now that it comes back in my head, Bruce Willis was an actor, or should I say was an actor. Well, he's alive, so it still is. But he stopped acting now. But I remember watching a podcast where the scientist was explaining the activities in brain, and they were mentioning that the more you give your brain challenges, you read, you put your brain to the test, you do puzzle. They said that it lower your risk of dementia.
Mm.
But Bruce Willis, I'm sure he had to be remembering his skits, his scripts. So is that a myth?
No, no, not at all. So we know that keeping the brain active is great. But remember, when we're talking about this, not a single driver, it's an accumulation. So all of these things that we're going to be talking about for modifying risk is not necessarily meaning you are not going to get dementia.
Ah,
No, we're reducing our risk.
so
And that's what
scientists,
we need to
so,
do.
so scientists can't find what actually caused dementia.
So the cause we know is these aberrant
Oh, the
proteins.
protein. Yeah, you did
Yeah,
mention that.
but we don't know why they go from functioning normally to not functioning normally. We know that things like inflammation is involved. You know, we know there's lots of different reasons, but there isn't a specific driving factor.
It's just like cancer. There's a disruption in the cell that develop.
Yeah, and it's how well the cell can actually manage that and mitigate that. And of course, you know, when we're thinking about the dementias, different parts of the brain are affected potentially with different types of dementias. It's different proteins, but what we see is that's where dementia is an umbrella term in relation to all of the presentations that we might see. But if you look at two people with Alzheimer's, they may have commonality around memory, for example. So memory and learning. This is associated with the hippocampus in the brain. And we know that the hippocampus is really affected by chronic stress. Cortisol is toxic for the hippocampus. So we know that chronic stress is one of those things we need to be managing to protect our brain and bring down our risk of developing it. What if I went off on a tangent there? I may well have gone off, but there we go.
That's fine. Is there any promising research out there for dementia?
Yeah. So there's a few things that are being looked at, but the most important studies at the moment are looking at younger brains and tracking their lifestyle and whether they develop dementia. Also, for younger age now, we're starting to look, for example, in Alzheimer's disease, do blood tests, because this is less invasive than taking cerebral spinal fluid, and having a look at some of the tau and amyloid proteins that might be presenting in the blood. So this is a part we need to be really recognizing early signs in order to intervene and slow the progression. And this is really important. Remember, once it's started, we can't stop it. So we want as many early indicators as possible. But also, we've had, there's been some more recently, some of the drugs that are being used. It doesn't cure, doesn't stop these diseases progressing, but using targeting, for example, the amyloid plaques. So the drugs place like a marker on the plaques, like a red flag that communicates to our immune system, come over here and get rid of this plaque. So we want to be introducing that earlier as well. So really it's all about recognizing, finding some biomarkers, some biological markers that suggest the brain is starting to struggle with the changes in these proteins. And then we can target early.
I don't remember if I heard you say this, but is there any inflammation on the brain with dementia?
Yes. Yeah, inflammation is a key driver of the pathology. Doesn't necessarily cause it, but it's a key. And the reason for that is the immune system knows that something's wrong and it wants to protect it, wants to clear it up. So the immune cells are like, okay, we've got these aggregates, we need to communicate with some of these other biological processes. One of them is called autophagy, where you come in and you clear like these aggregates, remove them, chop them up internally. This is a process called autophagy. So you see, we've got, we'll have inflammation. We will see certain processes happen where we encapsulate these proteins that are going wrong, chop them up, and recycle them, phagocytosis. But of course, when we are seeing an increase in these protein aggregates, these systems become overwhelmed, as does the immune system. And this drives, so we see a reduction in the removal of these aggregates and an increase in inflammatory processes.
The healthy part in my mind is telling me that these things have something to do with our lifestyle.
Yeah, we'll be talking about that.
No, definitely. What is one thing that you wish everyone understand about dementia?
Yeah, I think it would be to recognize it's not just memory issue. Memory certainly is involved, but also to remember that the person is still the same person. They may get angry. They may not recognize you. They may get scared. They may appear very different, but they are still the same person. And what's happened is those aspects of themselves, their personality, for example, the way they interact with people, their memory, that hippocampus I was talking about, that has changed because of the disease. It's not them as a person. They do, and I think it's really easy. Carers struggle with guilt because of the, getting cross with their loved one. They get tired, and of course they may get frustrated and cross completely, and then they feel guilty for being like, for feeling like that. And it's just a devastating disease.
It's sad.
It is. Yeah.
It is sad.
Yeah.
It is sad. But Dr. Tracy, thank you again for yet another successful podcast. I'm happy that we are talking about these things because it is shedding some light in my head. And one of the main thing is to take care of myself, to take care of my health. I've been trying to do that since my mom died of cancer, but there's so much to do when it comes to health, because it's not just eating right, it's not just exercising. The environment have a lot to play in many of these diseases. Sometimes I wish I could just go into the mountain and live like a caveman. Honestly speaking.
Yeah.
Honestly speaking, but thank you again.
If you like this podcast and you want to know more on the brain, what to do to prevent dementia, the signs to look out for, to navigate through ADHD, anxiety, and to better cope with it, join us into the next podcast. Until next time, stay safe, stay blessed, and eat healthy.